Well, thanks, everyone. I'm Mayor Jenny Wilson. Jenny is Jenny, Wilson, Wilson. Thank you for being here. And as you all know, yesterday, Governor Herbert reduced the statewide status of the Utah Leads Together directive from red to orange. That begins to open up many activities and closed businesses. As the mayor of Salt Lake County, the largest and most diverse county, the most densely populated county in the state, I have concerns and I'm requiring conditions for restaurants and businesses that are opening. But first, I want to share that we are progressing through this disease and our community has come a long way. We've protected our hospitals, our testing and case chasing are strong, and the level of cases in Salt Lake County shows we've dramatically pushed down the level of the virus in the community. For instance, 8 weeks ago, a person with the virus was spreading it to 6 people. We now know that our spread rate is averaging about 1 to 1.5, and that's great news. But that flatter curve means the virus will be with us for some time. And as businesses open, they will need to operate differently. And customers will need to take precautions as well. Face masks, social distancing, and sanitizing will be required. And frankly, we're hoping that some businesses will take their time to open, allowing a phase-in. In fact, when the Salt Lake County Government Center begins to open on May 11th, we're asking for only a 25% target of employees to return to the center in person. And we're asking businesses to be cautious as well. We can't go from 0 to 100. And we want our citizens and our residents to remain vigilant, especially protecting family and friends with underlying health conditions and the elderly. We need to be wise in our choices and wear face coverings. In fact, face coverings will now be required of businesses that interact with the public. And how many of you have gone to a home repair store or a convenience store lately and seen many people not wearing face coverings? This needs to stop. But as we begin to engage more in our community, all the while being cautious, Salt Lake County will also do more to attack the virus. We are expanding efforts surrounding education and prevention. We're focusing in areas of greater need. Teams will be connecting with communities in need. We will encourage testing when necessary and emphasize social distancing. And we are translating all of this guidance into multiple languages to make sure no one is left behind. And we'll be paying additional attention to areas that have higher cases. And lastly, Salt Lake County continues to review data on a daily basis and monitor our progress. We need to keep this virus stabilized. We're prepared to adjust as needed to keep the community safe. And by additional attention, we will minimize the risk in the community. Remain vigilant, remain wise, protect yourself and those you love, now more than ever. And we'll now hear from the Executive Director of the Health Department, Gary Edwards. Thank you.
Thanks, Mayor Wilson. I'm Gary Edwards, Director of the Salt Lake County Health Department. The social distancing measures and restrictions that have been put in place have been successful to get us to where we are today. But social distancing and other common sense disease prevention measures must continue as we enter this new phase. So we still need to stay home as much as possible. If you feel sick, you must stay home. If you're an older person or a person with underlying medical conditions that put you at higher risk, you're still in the red category. You stay home. As the mayor indicated, wear a face covering, a cloth face covering. They're the surgical face coverings. Wear a face covering. If it's a bandana, a t-shirt that has been cut and prepared as a face mask, face covering, wear a face covering. Protect yourself and others. Wash your hands often. If soap and water is not available, use hand sanitizer. Avoid touching eyes, nose, and mouth, and keep 6 feet distance from other people. Those things still continue. They are part of what we need to continue. So let me talk for a few minutes about what some of the various sectors will be required to do as we begin this reopening, this orange phase. For food service, takeout, curbside pickup, and delivery options are still the encouraged with some extreme precautions, such as employees and customers must wear face coverings except when actively dining. Customer groups are limited to a total of 6, and customer groups must maintain a 6-foot separation when dining and waiting. And obviously, anyone with symptoms, employee or patron, is not allowed to be in the facility. For personal service businesses such as hair and nail salons, day spas, massage, body art, tanning, these are to operate by appointment only. There is daily symptom checking of employees and symptom checking of customers. Employees and customers must wear face coverings, and workstations must be at least 6 feet apart. For gyms and fitness centers, certainly again, all ill individuals, employee or customer, are excluded. Employees and customers must wear face coverings. Customers can remove a face covering while being engaged in a heavy physical activity. Distancing of 6 feet, but that expands to 10 feet in workout areas. The employees must disinfect equipment after each use. Lap pools can have 1 swimmer per lane, and recreation pools cannot exceed 50% of their capacity, and there will be no hot tubs or children's swimming pools in this phase. With cultural and entertainment and sports venues, still no ill employee or customer. Employees and customers must use a face covering. 6-foot separation is the standard guideline. The establishment must monitor the number of guests entering and congregating. Seating has to maintain a 10-foot separation between household groups, and employees must frequently disinfect high-touch surfaces. As far as social interactions, these are limited to groups of 20 or fewer, but still remembering social distancing. Small groups of close friends and families who are not ill may attend funerals, weddings, religious ceremonies. Playgrounds, team sports, and other group activities are not allowed. And face coverings must be worn by employees in retail establishments. And again, anytime we as the public are out interacting, we should be wearing a face covering. More detailed information is available at slco.org/COVID-19. Also at the Utah Leads Together 2.0 site, or phone number 385-468-4636. Again, social distancing remains key, as well as the other common sense disease prevention measures that we've known about for years that are critically important at this time. Thank you.
Question. Yeah, Mayor, are you complying? Is this going along with the governor's directive? Is this going along with the governor's directive? It seems like yours are a little more restrictive, obviously, because of the higher caseload you're facing. But does this set up any kind of a challenge with the governor and the legislature who have obviously been pushing for more reopening?
Well, first I should say everything that Gary just outlined is in the state's 2.0. One of the objectives for us at Salt Lake County was to not have a Davis County resident who works in Salt Lake County have different rules. So we did a lengthy amount of assessment as to what we would need to do at Salt Lake County to reopen. And we found that our conditions pretty closely aligned with the governor and his team and that work. So at that point, we sort of took ours as a reference, but ended up adopting the idea behind and moving forward in kind of coordination, health department to health department, to implement the governor's 2.0. We are now in a position without an order from the governor to move today and state that we will require. We're waiting for additional feedback from the state today through the governor's office on what his actual order will provide, and we hear that we're going to get that clarity later today. But in Salt Lake County, if you run a restaurant, you're going to need to come up with a long series of conditions before you choose to open. And I made the point, and I hear this talking to restaurant owners, many are ready to go and many want to take more time. And I think there's a lot of in that. Think through where and how you operate your restaurant. If you're doing well with takeout, maybe continue to just provide takeout. There are areas of Salt Lake County that have higher rates than others. We're doing those additional interventions in those areas, more preventative education, more outreach. We know our Latino Hispanic population has a higher rate, and we are, as I outlined earlier this week, doing quite a bit in those communities from this day forward. So with that, we're mitigating best we can, but we will require, and if that requires a conversation with the state or the legislature, we're prepared for that.
Can you talk a little about enforcement here and how you plan to enforce this? Or businesses face fines or penalties? Or talk a little about that?
So any health order does have fines and penalties. They're required by law. If there were an existing health order, the temperature of the water needs to be a certain at a certain degree, then a fine would be attached, and the restaurant would go, or the enforcement agent would go in and confirm that that's indeed the case. So this indeed will have fines attached. Enforcement is in multiple ways. If it's a public enforcement, that would fall to the local jurisdiction, but health enforcement is through our health department.
You plan to enforce it? I mean, you plan to officers looking at some businesses or that?
So I'm going to let Gary answer how the health department enforces. We have all along asked for partnerships with our cities and their various police forces. It's really up to the local jurisdiction for enforcement, and we have multiple cities and townships in this county. But the direction we've given through our district attorney, Sim Gill, our sheriff, Rosie Rivera, is that we, in this era of concern, don't want to be heavy-handed. But where you see very large gatherings going forward and egregious violations, we would ask local governments to indeed enforce. So my understanding in terms of the length of our order is that we will replace our order with the new, and it's a very simple order. It will mirror the state's 2.0 plan and the rules that are established there. So any questions, we refer to that plan. we're providing some specific guidelines, and we'll mirror the state's timeframe, but all the while we monitor data on a daily basis, and any order can be repealed by the health director, Gary, and myself on a moment's notice and replaced with another. So I don't think people should be too should feel that the date on the order is the end date for this phase. It's not. And I think the governor said that as well. We're looking at compliance, progress. As we open up businesses additionally, we need to measure that impact. We will have interventions that we hope will counter and that we will remain stable. If not, we here will protect health and we'll take measures accordingly, working with the state as we need to return backward, not forward. I hope that doesn't happen, but we're yeah. So we're going to wait to see the governor's order today and then mirror that date. So I don't know that we have that right now. And I've heard 2 weeks. And I would ask Gary, have you seen? Yeah, we've heard 2 weeks, so we would then mirror, but we're waiting for the governor's order today so that we can, be legally compliant. But we had enough from him yesterday to want to give businesses and people information early today as we see things kind of play out later. Yeah, we do have those results. I'll turn it over to Gary in a minute, but another question for me before. So we're waiting for the governor, and it's May 1. We're trying to figure out if it's midnight, meaning in effect May 2nd or earlier. So that we're waiting for that, and we will mirror the date on the governor's order that should be coming out today.
Is this exciting? Is this, it's something you've always been waiting for? I feel like our economy is going to be able to survive this, or what are your thoughts about it?
Well, yeah, this is mainly, but it's created, obviously, a lot of difficulty to our economy. So I do believe we'll see some benefit on the economic side, but for me, health is still the priority, and we'll just have to manage our way through it. I do know a lot of businesses, small businesses, who can operate with the masks, face covering, social distancing, are really ready to get back. And we certainly expect people who are running those businesses to operate in a safe way, following the guidelines that are required, and believe it with that they can be operated safely. So for the businesses ready to go back, we do cheer for their success. We hope for that. But we are also asking everyone to kind of think through and understand this is a different world we're living in, and we're going to have this virus with us for some time. That was an unknown to me. I mean, as we entered into this conversation and this tragedy and this difficult time in our community 8 weeks ago, I didn't know what today would look like at the end of April. And what we do know is that we did a great job to stabilize our hospital system, but it's still with us and it's still deadly. I had Congressman McAdams over this morning, and we wore our masks and toured the building, and I talked to him about how we were running things through here. He had been a partner when I was on the council at supporting this operations center and keeping our health teams vibrant and skilled, and so relieved for the work he did and the work that I committed to that first year. And as we went through it, we recognized that, he is healthy and younger, but still ended up in the ICU. And I think the virus is still deadly. The spread rate is lower, but we have to remain vigilant and cautious. And when I see or hear of incidents like I've been told happen in some of our, home goods stores or convenience stores where people are not careful, it means we're going to have to do more to crack down. And that's just the reality we're going to have to live in for a while.
Are you comfortable with the governor's decision to move to this new level? I mean, especially as the mayor of the county that has the highest population, the highest case load, and all that.
Well, so the governor represents a state of 29 counties. Some of those counties have very few cases. In Salt Lake County, some of our cities have very few cases. So it's really tricky when we have such a large area and very landed in a place to comply with the state order. I'm doing it with caution. We're doing it perhaps with more requirements than the state will have. And it's possible we may need to ask the governor for that. He's indicated to be willing to do so. It's important that we recognize we live in a region and that we have to manage accordingly. So I move forward with caution, with some concern, and the data on a daily basis going forward. So with that, I'm going to turn this over to Gary for questions, including the one about the Resource Center.
Could you repeat your question about?
Has testing begun at that resource center yet for folks who may have been exposed to COVID-19?
The Gail Miller? Yes, testing happened. I'm not sure which day, but a few days ago. The results have come back, and what I had heard yesterday was that there were 2 additional positive cases. So very pleased with what the resource centers have done to prepare for the possibility of cases and then individuals that might need to be quarantined. They put in some very good measures.
How many total, and what are some of those measures?
How many total?
How many total do you think that 2 additional will be over?
That I don't know. I believe with 2 total, we're talking about 3, but I'm not positive on that, okay? And so what they are doing is screening individuals coming in, trying to keep individuals to certain groups each day that they are there, so that if we have a case, we're able to identify those that have the closest contact. Also not operating at capacity, so that we're able to have better social distancing within the facilities.
What is the difference between Salt Lake County's order and the state's directives and the governor's forthcoming order? Mayor preference, there are maybe some things where Salt Lake County is more restrictive and must get some kind of a thumbs up from the governor. What is the key distinction between the 2?
So the key distinction between what Salt Lake County will do and what the governor is going to do, and let me just, for all of you, I'm not doctor, okay? Just for the, oh, you said director, I'm sorry. You know, we are really trying to be as close as we possibly can. We are emphasizing masks perhaps more than is in the governor's guideline. Many times in the governor's guideline, it indicates masks are recommended. And we, in some of those cases, will be saying face coverings are required. Anything else?
Concerns that Salt Lake County residents will comply with things. I mean, we see the reports of playgrounds, kids are playing, grocery stores, some people act like what pandemic. People will get this message, or we need to be right back where we started.
This, from day one, has had to be a primarily responsibility that we own as individuals and as a community. And we must continue with that understanding and attitude. Now, certainly, whether it's a pandemic or just going on without a pandemic, we have individuals who do choose to not follow what are socially accepted practices. And that will be the case here. Going back to the question about enforcement, our hope is that enforcement is not a major focus of this. It hasn't been to this point. As a health department, we receive a few complaints every day. We follow up on those. We provide education, and individuals then comply. And we assume that that will happen here also. We encourage everyone, businesses as well as the public, to be familiar with what these requirements are. Again, saltlakecounty.org/COVID-19. Utah Leads Together 2.0 documents that are on the state's website, or for voice-to-voice question answering, 385-468-4636, to be able to get questions answered. But let's continue to work together as a community. Let's all own our responsibility and what we can do. If we continue to do that, we can continue to be successful. We do have some documents of the guidance that will be available on the Salt Lake County website, and can make those available if you're interested. Thank you very much.